Hello, very good morning. We are at Pine Grove Behavioral Health and Addiction Services with Colleen Munkle. How are you?
I am great, Chad. How are you?
I'm well. Thanks for being here. So you're the Director of Business Development here at Pine Grove. So what does that mean?
That encompasses a couple different areas of Pine Grove. So for example, one of those areas is our National Service Center, which is our admissions department for all of our outpatient treatment programs for children, adolescents, and adults here at Pine Grove, as well as our specialty addiction treatment programs. Pine Grove offers many highly specialized treatment programs, and so that's part of our specialty service line. So the National Service Center handles all of those admissions and all of those phone calls where folks are calling in asking about treatment for themselves or for somebody they love very much.
So you're not essentially treating patients just here in the Pine Belt in Hattiesburg. You're treating many patients come every day from the coast, but you're treating patients internationally as well.
That's exactly right. Pine Grove was established in 1984, and we absolutely treat patients from right here where we're located in Hattiesburg, Mississippi, all over the state of Mississippi and beyond. Patients travel for our care from all over the country and internationally as well. And that's because over the years, Pine Grove has really developed a reputation as one of this country's most comprehensive treatment campuses. We have highly specialized services here at Pine Grove that are very unique. So for example, one of the areas that Pine Grove really specializes in is the treatment of professionals, particularly licensed professionals. So I think when people talk about professionals, they wonder, what does that mean? We treat all professionals here at Pine Grove. We also treat some specialty licensed professionals as well. So we have a number of treatment programs that do care for licensed professionals. Another area is compulsive behavior. So Pine Grove was one of the very first treatment programs in the country to establish a program specifically for the treatment of compulsive sexual behavior as well. So we do treat compulsive sexual behavior in men and of course compulsive behaviors for women at our Women's Center treatment program. I think some of the other areas that really set Pine Grove apart is the fact that all of our treatment programs certainly treat addiction with our specialty treatment programs, but they also treat other mental health care issues that patients are struggling with, whether that's trauma, whether that's compulsive behaviors, and whether that's other mental health conditions. So Pine Grove is really positioned with our expertise to be able to help patients with a variety of mental health care and addiction treatment needs.
And since every situation is unique, it's important, I guess, to know that also that you have inpatient and outpatient services.
Absolutely. We provide inpatient treatment for children, adolescents, and adults. And a lot of people wonder what inpatient treatment means, and that would be acute care. So a patient is in need of immediate care and stabilization, and we provide that on an inpatient basis. We also provide inpatient detox care for patients that are going to be moving to one of our residential addiction treatment programs. And then, of course, we offer a full continuum of outpatient care for children, adolescents, and adults, whether that's a weekly therapy appointment or an appointment that somebody may have with their provider for medicine, for example, or other outpatient treatment programs, such as an IOP program, which stands for Intensive Outpatient Treatment, which is a couple days a week, or other levels of care. So we have a lot of outpatient treatment programs, as well as more traditional in-clinic services.
I think we learned a lot of things about ourselves during that COVID era. It seems like it was a lifetime ago. But what I think one of the most important things we learned is that a lot of things can be done virtually, and telehealth is also a big thing that you guys are doing now, especially for those folks who are not necessarily in your area when it comes to a general, I guess an entry-level conversation.
I think that's an excellent point, Chet, and I'm really glad that you brought that up. And I think that's important, particularly for our friends on the Mississippi Gulf Coast. If they're inquiring about treatment for themselves or a loved one, and they want to know whether or not Pine Grove would be appropriate for their care, all they have to do is call our phone number, and they're going to reach our National Service Center, which I mentioned, and our team is going to be able to provide a clinical assessment. Of course, that's at no charge. We'll provide a clinical assessment. We'll staff that person's needs, talk about that patient's specific healthcare needs with our professionals here at Pine Grove, and make a recommendation as to the treatment program that would best serve that individual's needs for care.
And so, who exactly, whenever if they're listening now and
Yes.
something's ringing true and they call that number, who exactly are they going to speak with?
Oh gosh, they're going to speak with one of our highly qualified staff RNs who's going to answer the phone, or one of our licensed clinical therapists, or one of our accomplished outreach specialists who's really going to be able to talk them through the different levels of care that we offer here at Pine Grove. I think that's important to talk about because that's a very difficult first call for someone to make. It can be intimidating to call a place like Pine Grove. That can be hard. And it can also be hard because sometimes that's the very first phone call that somebody may make to talk about what's been going on in their lives.
Sure.
Or the life of somebody they love and care about very deeply. And it's difficult sometimes to talk about why you're reaching out for help, and to know that somebody who's caring, compassionate, and experienced in this particular area, a friendly voice is on the other end of the phone who's going to be able to help you, is very reassuring.
I think the hard part is being able to admit that you need help with something, whether it's you or your loved one.
That's exactly right. I think that that's so important because I think sometimes people are concerned about reaching out for mental health care. And the truth is, mental health care issues impact every one of us. Adults, children, adolescents struggle with these issues all the time, whether that is grief, whether that's anxiety, depression. Some people are struggling with addiction, and I think that it's important to reach out for help and to normalize the conversation about reaching out for care. And that's what we work very hard to do here at Pine Grove, is increase the public's comfort level with talking about these issues, and most importantly, reaching out for help, because we've got highly qualified professionals who are able to lend an expert and caring hand.
Absolutely. Yeah, that's the thing, is if you're listening to this conversation right now and something rings true to you, and this has been something that's been bothering you for however long, call that number at the bottom of your screen, reach out to them on the website. They will have, like you said, qualified professionals ready to help you, ready to answer the questions that you don't even know you have. Colleen, thank you so much for being with us today.
Thank you, Chet.